Dr. Amanda Jones, and today I'm going to be talking to you about rabbit hemorrhagic disease and what you need to know to keep your rabbits safe. A little bit about me. I've been a veterinarian since 2014 and I'm a proud rabbit owner and 4-H mom. I've been working with RHDV2 since 2020 in the first outbreak in Texas. Rabbit hemorrhagic disease is caused by a virus called rabbit hemorrhagic disease virus type 2. This is an RNA virus. And the important thing to know about RNA viruses is that they like to mutate quickly. This disease affects both young rabbits and adults equally. It's very sticky and it's stable in the environment. It can live on surfaces for up to 3 months in the environment. It causes sudden and severe liver failure. When you have really severe liver failure, that can lead to bleeding problems in the body. If you are already familiar with this virus, you may know it as the virus that causes bloody noses. While rabbits affected don't always have a bloody nose, that bleeding problem comes from the liver failure that this virus causes. The bleeding problem is also where we get its name, rabbit hemorrhagic disease. Hemorrhagic means bleeding. It was first reported in France in 2010 and has been reported in the United States since 2019. It is now endemic in the western part of the U.S. This virus only affects rabbits, domestic rabbits, and it now does also affect our native wild rabbits and hares in the U.S. Rabbits get RHDV virus through a couple of different methods. Direct contact with a sick animal is a great way to get exposed and become ill with this virus. You can also get it from exposure to insects. Bites from flies can transmit the virus, but also just having contact with the flies that could carry the virus particles on their body or legs is a great way for rabbits to become exposed to the virus. One way to think about this is if a fly is out in the field and lands on a wild rabbit that has died from RHDV2, it can easily pick up the virus particles on its legs, fly into your home, and then transmit and drop off those virus particles into your rabbit's cage. It can also travel via fomites or objects. Great objects that can transmit this virus are hay and feed, cardboard toys, or any object that may have had contact with the outdoors and exposed to the virus. One thing that you really should keep in mind is with our global shipping market, it's very easy for objects you typically would not think about may potentially be exposed to this virus. If you think about it, most of our hay is grown in the western part of the U.S., where this virus is endemic. You order packages all the time off of Amazon. And I don't know about you, but when I get a package from Amazon, a lot of times when the first things I do is drop it off inside the door. And if you have a free-ranging bunny, they may be able to come over and chew on that cardboard. A lot of our packages do come through California ports. Once again, a state where this virus is endemic. So really almost any object that you're bringing in from the outside could potentially be exposed to this virus particle. It can also live in the environment, soil, dirt, and grass for extended periods of time. How do you know if your rabbits get this virus and get sick? Unfortunately, the symptoms are vague, and this virus does hit very quickly. Rabbits, once they start showing symptoms, can become very ill and die within a day or two. Some symptoms include not eating or drinking, red eyes, being painful, having a hard time breathing, sudden weight loss, not walking very well, bloody nose or bloody urine or diarrhea. Now, the important thing to remember is this is not necessarily a common symptom. Many rabbits who get rabbit hemorrhagic disease do not show signs of bleeding. They may have a fever And just before death, they may have seizures. Unfortunately, a lot of rabbits who do get rabbit hemorrhagic disease do die. It has a mortality rate, a death rate of about 40 to 80%. I wanted to show you a map of the current outbreaks of rabbit hemorrhagic disease virus. As you can see, outlined in red, these are the states where it is endemic. Endemic means that this virus is present in the environment and is never going to go away. It is going to live in the soil, and we anticipate cases happen periodically for basically forever. It is not endemic in the eastern part of the U.S., but if you notice those little blue dots on the map, those are all cases of rabbits that have gotten sick and died from RHDV2 in the eastern U.S. And a lot of these times, these are indoor-only rabbits that should have been low risk. But like we talked about earlier, it's easy for this virus to find sneaky ways into your house to expose your rabbits. Now, what do you do if you suspect you have RHDV2 in your rabbit or in your barn? First things first, call your vet. They may be able to help provide supportive care to your rabbit and talk to you about how to test for RHDV2. Unfortunately, the only way to test for RHDV2 currently in the U.S. is if your rabbit dies. They will then send off parts of the liver to be tested for the virus. If you can't talk to your vet, or if you do not have a vet, the next thing you need to do is look up your state veterinarian and call them. There are special protocols that we must follow to determine if RHDV2 is in fact what has caused your rabbit to die. This is a reportable disease. We are trying very hard to keep track of its spread and the cases that happen in the U.S. So it's very, very important, if you suspect that you have RHDV, to reach out to your vet or to your state veterinarian to get tested. Don't bury or burn the bodies, and place dead rabbits double bagged in a refrigerator until you can get a hold of either your vet or your state veterinarian. Start disinfecting your home if you do suspect RHDV is present. This is a very hardy virus, so you're going to want to use a strong disinfectant such as bleach. How do you prevent your rabbits from getting this disease? The best way is going to be through vaccination. Vaccination is very effective, and vaccinated rabbits that have been challenged with this virus do not die. So we want to use the Hemorrhagic RHDV2 vaccine. A little bit about this vaccine. It is a subunit protein vaccine. In other words, we take a protein that is on the virus particle that really stimulates the immune system, and we put it into this vaccine combined with a couple of other ingredients that will help stimulate the immune system. Once your rabbit has the vaccine, your rabbit's immune system will learn about this protein and build antibodies and an immune response to it, so that if we were to get it in real life, their immune system is already primed to fight off the virus. You're going to do an initial vaccine, and you're going to booster it in 21 days. So you need 2 vaccines to start in an unvaccinated rabbit. Every year you're going to do a single booster vaccine. This vaccine has been shown to be very effective in studies. As with any medication, vaccines can have some rare side effects. The most common ones with this vaccine are going to be not eating or drinking well for 1 to 2 days, or a little bit of swelling or pain at the injection site, similar as if when kids get their vaccines. How to prevent it? The other way that we can use to help prevent this virus is using biosecurity. That is trying to keep the virus particles out through strict cleaning and control. You're going to want to keep your rabbits indoors only, with no outdoor time if they are unvaccinated. You're going to want to clean and disinfect cages before and after shows, and feed hay that has been stored for 3 months. If hay has been stored for 3 months, if there was virus particles on that hay, hopefully they are now inactivated and no longer infectious. But that is not foolproof. If you have a 4-H show rabbit, you're going to want to keep them in a separate area from breeding rabbits. You're going to want to use foot baths to help disinfect your shoes as you come in and out of the rooms where you keep your rabbits. And you will have to practice very strict fly control, keeping flies out of your house and barn. If you are interested in pursuing the vaccine, but it is too expensive for you to vaccinate all the rabbits that you have in your program, there are some things that you can do. Work with small animal general practitioners, mixed animal vets, and large animal vets in your area. Sometimes they can charge slightly lower prices than exotic specialists. Provide information to your vet about how to buy this vaccine from Medgene and the importance of vaccination in rabbits and the disease. And then help them. Help them to put on a vaccine clinic. Volunteer your time. Find a location to help them. Provide support running paperwork so that they can help you protect your 4-H rabbit community with a lower cost vaccine clinic. If you have any questions about rabbit hemorrhagic disease virus, the vaccine, or any help with your 4-H rabbit program, please don't hesitate to reach out to Medgene. Thank you very much. Bye.